Hi, my name is Yamilet Maya, and I will be performing my administering of oral medication skills video. I have gathered my supplies here, which is my drugs, some water, my gloves, a cloth, and two of the cups here. First thing we're gonna do is we're going to verify the healthcare provider's orders, and we're going to do the 6 rights of medication administration rights, which is the right patient, the right drug, the right dose, the right time, the right route, and the right documentation. So we have our medications here, which is amoxicillin 250 milligrams, our metformin 500 milligrams, our Benadryl 25 milligrams, and back here we have our Tylenol, which is 500 milligrams per 15 milliliters. Once we have gathered all of our supplies here, we are ready to enter the patient's room. First thing we're going to do is knock on the patient's door, and we're going to enter the room, close the door and the curtain behind us for privacy, and we're going to introduce ourselves to the patient. Hi, Mr. Smith. My name is Yamilet. I will be your nurse today. Can I have you state your full name and your date of birth? Perfect. Once the patient states their name and their birthday, we're just going to check that against the wristband to make sure we have the correct patient. Before we begin, Mr. Smith, do you have any allergies to medication, food, or environmental factors? No? Perfect. We're going to go ahead and perform hand hygiene, and I'm going to apply a clean pair of gloves on. Okay. I'm going to lower the rail on my side here, and we're going to have the patient in a sitting position to administer the medications. I'm going to go ahead and, Mr. Smith, I'm going to go over all the medications you're going to have, what are our pre-assessments, what the medication is good for, some common side effects, and some adverse effects. So we're going to go ahead and get started. I do have my amoxicillin here, which is 250 milligrams. Our pre-assessment for this medication would be to check if the patient has any allergies to penicillin. What this medication does, it's an antibiotic that it is used to treat bacterial infection. Some common side effects are nausea and vomiting. Some adverse effects are hives and difficulty breathing. We're going to put this into the medication cup here. Our next medication is going to be our metformin. It is 500 milligrams. Our pre-assessment for this medication would be to check the patient's blood glucose levels and check the kidney function. What this medication does, it is an anti-diabetic medication that is used to help glucose levels. It has helped to lower glucose levels. Our common side effects are nausea, diarrhea, and decrease in appetite. Some adverse effects are weakness and trouble breathing. We're going to go ahead and put this in the medication cup. We have Benadryl, 25 milligrams. Our pre-assessment would be to assess the patient for alertness. What this medication is it's an antihistamine used to treat allergies, itchiness, and is used as a sleeping aid. Some common side effects are drowsiness and dizziness. Some adverse effects is confusion and rapid heart rate. Okay. So these are all our tablets and capsules here. I'm going to go over the Tylenol as well. So this is our Tylenol. It is 500 milligrams per 15 milliliters. The way we do our pre-assessment would be to check the patient's pain level and check the temperature. What this is good for, it is used to reduce pain and reduce fever. Some common side effects are nausea and a headache. Some adverse effects are dark urine and yellowing of the skin and eyes. I'm going to put this to the side because we're going to administer this after they take the tablets and the capsules. Okay, Mr. Smith, do you have any questions before we get started? No? Perfect. So we're going to, again, make sure the patient is in a sitting position. We're going to give the patient the capsules and the tablets. We're going to talk to the patient and see what their preference is, if they want to take one by one or if they want to take all at the same time. Mr. Smith, would you like to take one by one or would you like to take all 3 at the same time? All 3? Perfect. So we're gonna go ahead and give the patient their medications and provide some water. Perfect. Okay, Mr. Smith, did you have any complication or any trouble swallowing that? No? Great. We're gonna go ahead and move on to our Tylenol. So we have our Tylenol here in a bottle. What we're gonna do is we're going to mix it by moving it gently, just going like this, up and down, to make sure we mix everything in the bottle. The way we administer liquid medication is we're gonna do it at eye level. There is a couple things we're gonna do. So once we have mixed it, we're going to remove the top of the cap, and we're going to lay it flat on the surface here. What we want to do is we want to hold it by, we want to cover the label to cover the name of the medication in case it spills or anything. We have the label that is not getting, you know, wet or anything. Once we do that, we're going to put our measuring cup there on a flat surface, and we're going to administer the 15 milliliters at eye level. Perfect. And now we're gonna go ahead and, before we put the cap on, we do want to wipe the around the top and inside to make sure it is clean. And then once we do that, we can put the lid back on. Okay, and then now that we have the 15 milliliters on here, I'm just gonna show the camera to make sure it gets the 15 milliliters on camera. Let's see. I don't know if you can see. There you go. It is right at 15. Maybe you can see better on this side. Let's see. Okay, as you can tell, it is at 15. Perfect. So once we do that, we're going to give the patient their Tylenol. Sorry, got a little blurry. Okay. So we're going to provide, again, let me just show the camera because I want to make sure it got it. Let's see on this side. Are you able to see the 15 on here? Okay. So now we're gonna go ahead and give the patient their Tylenol. Okay. And some water. Perfect. Alrighty, Mr. Smith, how are you feeling? Good? Do you have any questions for me? No? Okay, we're gonna put the patient on a comfortable position, put the collet within reach. We're gonna put the rail back up, and we're going to remove our gloves, and now we're gonna go ahead and document the medications that were given, what time, what dose, what route, make sure it's the right patient, and the right documentation. And then if the patient has no more questions, I will come and check on them in a little bit to make sure everything is okay.